Welcome, class, to our Week 5 presentation for ME 150. Week 5 always feels so good because we are officially midway. After this week, it is the tail end of our class, so 5th lecture out of 10, to me, that always feels really great. Let's dive right into our content for this week. Our reading focus this week is Chapter 6, and it's Defense to Liability Suits, which offhand might sound kind of boring, but it is pretty interesting. Medical malpractice and liability suits, that's a huge thing in medicine. Malpractice insurance is quite expensive, but definitely necessary. So it's always good to know how to prevent and how to defend in situations that may arise if you are indeed facing a liability suit. We're going to start with the 4 C's of medical malpractice convention: caring, communication, competence, and charting. And they are all very important. I don't know that one is more important than the other, but definitely the 4 C's are important to know. Next, we'll look at 7 reasons for malpractice. So in order to understand how to prevent it, you have to know reasons that it occurs. And here are our 7 top reasons. Number 1, error or failure or delay in cancer diagnosis. Boy, we can see how that would be a problem. The second one is birth injury or negligent maternity care. The third one is wrong diagnosis or misdiagnosis of negligent fracture or trauma. Fourth, we have delay in diagnosis or failure to consult in a timely manner. Fifth, medication errors or medication malpractice from negligent drug treatment. Sixth, we have malpractice resulting from physicians' negligent procedures or surgical errors. And last but not least, we have failure to obtain informed consent. To me, probably from your shoes, the one that's going to be most likely that you can impact is that failure to obtain informed consent, because often that falls to the MA to go over the informed consent with the patient. So that's very important to kind of be aware of in our scope of practice. Actions to prevent litigation. All of these are extremely important. Explanation and apology. Sometimes that's all it takes, is to explain what happened and a sincere apology if something went wrong. Correction of the mistake, always a good thing. Financial compensation. Correct treatment at the time. Of course, if we do what we need to do correctly at the time, that's always great. An admission of negligence. Sometimes people just want to hear, "You're right, that falls on my shoulders." Listening to the patient. Disciplinary action against medical personnel involved. To me, that's more of a hospital kind of thing, or even a large medical practice could discipline if it was an MA or a receptionist or someone like that was involved. Honesty. And, of course, investigation by the hospital. Sometimes people just want things looked into so it doesn't happen again. Communicating with patients. Let's go over this because this is something we can all impact no matter what you do. Develop good listening skills. Often we listen and formulate a response instead of truly listening. So instead of listening to respond, we need to listen to take it into our heart and figure out, okay, what is the patient telling me? And just focus on what they're saying. Set aside time of the day to call back patients and provide advice. Really be sincere in the amount of time that you take to do that. Obviously, you can't have all day, but don't try to rush and do it in between everything to where the patient feels like, oh, I'm not getting the best of you or the best answer because you sound like you're rushing to the next thing. Thoroughly explain illnesses and treatment options. People want to be informed, especially when it comes to their health. So we need to make sure that we are helping them with that. Make sure informed consent forms are signed, that we just haven't gone over them and not have them sign them, but they did indeed go over them, they've asked questions, they've acknowledged understanding, and they have signed the form. Avoid statements admitting fault. It is not our place to say that the doctor did something wrong. If the doctor wants to admit fault, that is on him or her. A few more. Use tact, Good judgment and professionalism with patients, always good advice. Refrain from overtly optimistic statements. An example. Oh, if you have this surgery, it's going to fix everything. Oh, you'll be 100% in a week from now. Those are overtly optimistic, and they are pinpoint saying that this is definitely going to happen, and that's where you can run into trouble. Advise patients when physicians will be gone for long periods of time. Definitely a good thing to do. If the doctor's going to be out on vacation, we're going to say, Dr. So-and-so is going to be out from this time to this time. This doctor will be covering his patients during that time. So they know he's going to be gone, or she, and they know who is going to be in charge of their care during that time too. Reach an understanding about fees. No one likes surprises, especially when it involves money, so we want to make sure we're clear and upfront with anything that involves fees. Documentation. Oh my goodness, I cannot tell you and stress to you the importance of this. Basically, I'm from the school of thought that if it's not in the chart, it didn't happen. So everything that happens needs to be documented in the chart because that is your legal court document. And if it's not in there, guess what? The court isn't going to take your word for it. It's not in the chart. How could that be? How could that have happened if it's not in the chart? That's what people are going to look at legally. So we need to make sure documentation is extremely accurate, timely, and that we all understand the importance of it. And this includes things like referrals, missed appointments. If someone's not showing up, that needs to be documented for sure. Dismissals from care, treatment refusals, basically all other patient contact. Anything that happened needs to be in the chart. Again, I can't underestimate that to you. Types of defenses. So let's say a liability suit was brought to the office and they're meeting with an attorney to try to figure out what can be done. This is basically the different types of defenses that could be taken. A denial of wrongdoing, just a flat out, that's inaccurate. Affirmative defenses, so let's go through these. Contributory negligence. This alleges that the plaintiff, through a lack of care, caused or contributed to his or her own injury, meaning the patient, through a lack of care, helped cause the injury. Comparative negligence, alleging that the plaintiff contributed to injury by a certain degree. Assumption of risk. The defendant is not guilty of negligent act because the plaintiff knew of and accepted beforehand any risks involved. You can see where that would really come into play with a signed informed consent. Emergency. Let's go through this on the next slide. So, conditions for emergency defense. A true emergency situation existed and was not caused by the defendant, meaning the patient was in a true emergency. The appropriate standard of care was met given the emergency situation, and they did what was appropriate at that time, meaning the doctor performed within the scope of care and did everything that any other doctor would have done in that situation. There's also things called technical defenses, and we're going to talk about each of these. Let's start with release of tortfeasor. We talked about that word tortfeasor, I believe, last week, so it hopefully is not new to us. It's a technical defense that provides a lawsuit against the person who caused an injury, and that person is called the tortfeasor. He or she was expressly released from further liability in the statement of the suit. So the victim cannot sue the physician unless the right to do so was reserved in the release. That's the release of tortfeasor. The next one is res judicata. The thing has been decided. A claim cannot be retried between the same parties if it has already been resolved. So it goes back to that double jeopardy. Once you have been tried and something has been resolved, you can't just go and redo it again. Statute of limitations. This varies from state to state, so the amount of time can be different in Missouri as in Kansas or Nebraska or Arkansas or wherever. Generally specifies 1 to 6 years, so that's a common range, with 2 years being the most common. It specifies when the statute of limitation begins. It may be modified for minors, people who are legally insane, or special circumstances. So there are times where it is adjusted, but it has to be an extenuating circumstance. That's not the norm. Now we kind of know a little bit more about liability and malpractice and defenses against it. Let's talk about risk management, because this is very important. Risk management basically is taking steps to minimize danger, hazard, and liability, which is great. This should be something that every office, no matter where you work, has a plan for risk management. It helps reduce the possibility of lawsuits, identifies problem practices or behaviors, because we want to identify them before they become a bigger issue, and then problem solves to eliminate problems. That's the most important piece, not just to identify the problems, but then to have plans to resolve them. Also of importance is quality improvement and assurance, and a lot of accreditation standards fall to this quality improvement and assurance, and that's where the Joint Commission that accreditates many healthcare facilities really focuses in on this. Programs to uphold the quality of patient care and reduce liability risk. There's parts of the method used to manage risk, and it includes compliance with federal, state, and local laws. All good things. Couple of reminders. Actually, let's go through the liability and then I'll give you reminders. Professional liability insurance. This is important. It covers cost of defending a medical malpractice lawsuit up to the policy limit. It's very important that the medical office you work in have professional liability insurance. Most insurance companies that a doctor would contract with will require that physician to have medical liability insurance and want to see copies of it and things like that. The cost of insurance is based on the physician's specialty and dollar amount of the policy. It usually is required to obtain hospital privileges or work with an HMO or insurance company. So usually it's not an issue of them not having it. It is a big expenditure for the doctor or the medical office, but it's one of those necessary things. It's kind of like having car insurance. You have to do it, and sometimes it costs a lot, but the minute you need to use it, you'll be thankful you have it. So, since it's week 5, I just want to remind everyone that you do have a midterm exam this week. After I review the midterm exam, the content comes from weeks 1 through 4. So I want you to really hone in on our previous weeks when studying for the midterm exam. Also remember the point total for your midterm is higher than your normal quiz. So it will make a bigger impact on your grade, positive or negative, and we want it to be positive, right? So do make sure you prepare accordingly, and also be sure to do your discussion and assignment for this week. As always, if you have questions, my door is always open to you. The information for our presentation did come from your textbook this week, Law and Ethics for Healthcare, or Law and Ethics for Health Professionals. Thank you so much for your time. Enjoy your week.